really it was changing my mindset from somebody should or somebody needs to I can do this or we can do this as a team. And so that's really how my leadership journey began, is recognizing where there was a gap and saying, I can do this, or I don't know how to do this, but I can figure it out as I go.
Welcome to the Critical Chats podcast,
or as I'd like to call it, Crit Chat,
where we talk about the new and exciting developments in the critical care world and get to know the providers behind the medicine.
I am Sheila Billica, PA.
And I'm Katie Shakura, PA. We're your hosts, and we're with our producer, Sneha.
I'm also a PA.
3 PAs on a pod.
Hi, welcome to another edition of Critical Chats. I'm the guest host today, Johnny Isenberger, and we're lucky enough for our guest Dawn Carpenter to be with on this month. How you doing, Dawn?
I'm good, thank you.
Dawn is a nurse practitioner on the Trauma and Surgical Critical Care Service at Guthrie Clinic Health in Pennsylvania. She's also an associate professor at the Chingfen Graduate School of Nursing here in Worcester, Massachusetts, and also on the board of directors at the American Association of Critical Care Nurses. Dawn, tell me a little bit about yourself. What sort of things are you doing?
Well, I'm a nurse practitioner in surgical and trauma here in Pennsylvania. We are at a rural level 1 trauma center in the northern part of the state. We cover probably 30 counties between Pennsylvania and New York, and we're pretty busy. We do a lot of complex surgeries and have a lot of really sick patients, which is kind of surprising given how rural we are, but we're right up there with the types of patients we see at UMass and other academic medical centers.
Awesome. Now, I know you're very involved in leadership opportunities and you're a recognized leader across the country. So tell me about your leadership journey. Where did it start? Where did it start and where is it now?
That's a great question, Johnny. When I was thinking about this, it's hard to know where to start. But I think the first part where I really found myself embarking on a leadership journey, I was one of the first 3 nurse practitioners hired at UMass in the surgical ICU there. And there were things that needed to be done. We didn't have a schedule. We didn't have anybody to precept us. We had people coming on board. We didn't have any orientation materials. And the 3 of us looked at each other and said, somebody should do this. And so we had to try to change our perspective from someone should to I can do this. And we just kind of each took on our own piece of what we were able and had the skill mix to do. And where we didn't have the skill mix, we sought out expertise. And so it started really out of necessity. And then I really thought about what else needs to be done? How do I advocate for our team? What do we need to help our team grow? And I started advocating for those types of things. It's really, we need this, or we should do this. And it's like, well, I can get that. I know who has that information. I can advocate for us. So really it was changing my mindset from somebody should or somebody needs to I can do this, or we can do this as a team. And so that's really how my leadership journey began, is recognizing where there was a gap and saying, I can do this, or I don't know how to do this, but I can figure it out as I go. And just kind of learning on the job training was a big part of it.
Mm-hmm.
And then eventually you got invited to do committee work, and as challenges arose, they turned to you. And like I said, if you didn't have the answers, you found who had those answers. And then subsequently, they developed a formal leadership role, and I was able to participate at that level and help lead the team and help grow the team as well.
Mm-hmm.
And then eventually, the next step for me was somebody tapped me on the shoulder and said, I need a lecture. Can you do a lecture for us? And I, of course, said, sure, I can do that. And so I didn't really know. I mean, I did a few presentations in school, but to really give an academic lecture, I sent my slides to the lead faculty and said, does this make sense? Is this what you're looking for? I sought feedback. And then I got that lecture done. And the next thing they know, they're like, we need a coordinator for the track. Do you want the job? And so people will tap you on the shoulder once they see that you have some initiative and you take some feedback and you integrate things. And it's just been a really rewarding journey because, healthcare is just lifelong learning, and so is
Mhm.
leadership. Leadership's the same way. It's ask for feedback, say yes to things, think about how you can contribute. How can you make things better? How do you shape things into what your vision is?
Mhm.
And I got pulled into being a doctoral student next, which was really where I learned how to lead a project, how to get feedback, even more feedback, and then how to
Mhm.
navigate obstacles to get your desired outcome achieved. And then I became full-time faculty, and that's really where my leadership growth was born and really took off. I was part of a junior faculty development course where I was given a formal mentor and a project to execute and hone those skills. And then it was publishing was a requirement, so I didn't know how to publish and learned on the job and had some great mentors
Mhm.
along the way. I had some great colleagues that just I asked for help and they were more than willing to give us that time and energy to develop me because they saw that willingness that I was willing to learn and willing to kind of put myself out there. Um,
Mhm.
and that's really one of my mentors got me networked with AACN to be able to volunteer with them. And that's where my engagement with AACN has launched, is from my faculty role.
Yeah, the AACN, I understand you've taken on quite a leadership role there as well. AACN, of course, is the American Association of Critical Care Nurses. Dawn, what sort of things is AACN involved in? What sort of things can nurses and advanced practice nurses get out of AACN?
Another great question, Johnny. So AACN, the American Association of Critical Care Nurses, is the largest specialty nursing organization, and their mission is to drive excellence for both acute and critical care nurses, for both patients and families as well. So
Mhm.
they are highly involved in advancing clinical practice. They have a wealth of educational material for both nurses and advanced practice. They've published staffing standards. They also have a whole clinical scene investigator academy, so where they help teach you how to solve some clinical problems.
Mhm.
They also sponsor the annual National Teaching Institute conference, which is where about 8,000 critical care nurses come together. It is the premier
Wow.
conference for critical care nurses.
Wow.
Yeah, it's something to experience. You have to go at least once in your career,
Yeah.
go every year. We
Wow.
also have a certification arm that has about
Okay.
15 specialty certifications as well as subspecialty exams. Uh,
Hmm.
the primary ones are the adult that I've been involved in are the adult gero acute care nurse practitioner and then the CCRN exams. Those are the two that I've helped write items for and been on the
Hmm.
exam development committee. But they have a lot of other certification exams as well.
Okay. Are they involved in research as well?
Yes, they do some research. A lot of the research that they've sponsored has to focus around their what they call the crux of their work, which is finding um, and helping people create the healthy work environment. So they've published healthy work environment standards. They help nurses
Got it.
implement that. And what they found is with healthy work environments, that you have longer retention, you have
Hmm.
greater job satisfaction for nurses, and they've continually evolved the healthy work environment survey. There's now a survey for teams because we know care is delivered in team format. So
Yeah.
there's healthy work environment that I would encourage all teams to at least take the survey. And if you focus on one of the standards, you'll notice that your results, if the team focuses on enhancing one standard, all of the standards come up on repeat surveys. So
Wow.
it's a huge impact on work environment and nurse retention. It reduces burnout, and the nurses are much more engaged in helping to solve their own work environment problems.
Is that how the Beacon Awards got started? Is that recognizing healthy work environments, or is there more to the Beacon Awards?
Well, the Beacon Award starts now. It's evolved over time. The Beacon Award highlights you start with the Healthy Work Environment Survey tool, and then you
Mhm.
use that environment and you work on clinical areas to improve things. And again, monitor your outcome from the projects that you're working to improve, whether it be CLABSIs or CAUTIs or, ventilator associated events, all of those quality indicators. And then you submit your whole application, and then um, that then determines the outcomes for whether you're gold, silver, bronze, a Beacon Award, Beacon unit.
Yeah, I think some of our nursing units were sort of working towards Beacon Awards and sort of discussing it amongst their unit-based councils. It sounds like something that would not only benefit the staff, the institution, but also the patients to sort of work towards that endeavor. Sounds like
Yeah.
an excellent, excellent thing that AACN is, of course, always at the forefront of these special things. And, that's another cool thing to be involved in.
Mhm.
So, if I wanted to join ACN or somebody listening wanted to join ACN, how did they do that? Like, how did you join the organization? How did you become a leader within that organization?
So my first interaction with AACN was when I was my first unit I ever worked in. The goal was 80% of the nurses who were eligible were certified with CCRN. That was like our unit standard. And so
Wow.
expectation that once you hit the required hours mark that you would be preparing for sitting for CCRN. And so it was just a natural. You became a member, you studied, you took your CCRN, and then to maintain your CCRN, I used all of their educational resources
Hmm.
to maintain that. But then I also, as I became faculty, I used a lot of the AACN resources for guiding the environment in the classroom for the acute care NPs. I used their scope and standards of practice for the adult gero acute care nurse practitioner. I used that resource to also publish a review book and practice question book. And now I actually publish in their journal some of the articles that we've co-authored together. Uh,
Hmm.
but I would say if anybody doesn't have a clue where to get engaged with AACN, I'd start with aacn.org is the website to go to be able to access and become a member. The membership price has not changed since I joined back in 1991. I don't think the price
Wow.
for membership has changed since then. So it's probably the most economical organization to become a member of, and there's about 133,000 nurses that are members of AACN.
Yeah, you mentioned the CCRN. I remember taking that back in the early 2000s, and I've maintained that certification throughout all these years. I recall when I interviewed for graduate school for my master's degree that the person I interviewed with was the late Dr. Miller, who remarked on my CV that I had my CCRN, and she sort of lightened up a little bit and was thought that was a great accomplishment. And so it sounds like the same for you is the CCRN certification sort of started the flame and started triggering a lot of these different opportunities for you.
Yep, exactly. And I like the way you phrased that, it flamed my excitement and
Mm.
thirst for more knowledge because I realized how much knowledge and how much information was really out there. And I just wanted to be, part of that organization. And I really admired the people who were on the podiums, who were talking and lecturing. And that's where I kind of gathered my vision of what I wanted to be, how I wanted to
Mhm.
be. And I'm like, I want to be like them. They were role models for me. And so I remember when our dean, Joan Vitello, was the one of the presidents of AACN. And so back in like the early 90s, 92 maybe,
Mhm.
was her year to be president. And so she's also, as part of my faculty journey, has continued to champion my engagement with the organization. And that's really my professional home right now is being a member of AACN and finding people with like minds that really want to do good patient care.
Awesome. So now you've worked up. You're now are a big member of the AACN. You're actually on the board of directors. So how did that come about? What was that journey like?
The journey was an exciting journey, but it took me I would say a long time, but it was on my vision. So I started my
Mhm.
leadership journey and I needed a vision. And Joan Ardeen was one who was like, I could see you on the board of directors. And then I thought, well, how do I get there? So I started with volunteer opportunities. And again, it's about saying yes to opportunities, kind of volunteering yourself a little bit for opportunities. And I started off with an item writing, learning how to write questions for AACN, for CCRN, as well as the adult gero acute care NP. So I started with item writing. Then I got invited back and applied for the exam development committee. And then I thought, well, I love this conference. How do I get engaged with being part of the people who choose the topics? So I applied for the uh, it's so part of NTI has two tracks. One track is nursing, the other is the advanced practice track for clinical nurse specialists and nurse practitioners. And so I applied for the Advanced Practice Institute Planning Committee, which is a subset of NTI, and then was eventually the co-chair of that committee. And then another opportunity, I was all set to be the chairperson for the planning committee when I applied for and was elected to the nominating committee. And the nominating committee are the people who review applications and look at leadership competencies and who's ready to go on the ballot for the board of directors. And so that was kind of my study guide, so to speak. And I had an opportunity to watch and learn and network with other members through this whole process of volunteering, just getting to know other leaders and learning from them and asking them questions and picking their brains and how did you do this and what types of things did you need to be able to do to be on the board. And so then, I had to the whole application, the whole piece of becoming a board member was I had to put myself out there and self-nominate. I had to do a written application. I had an interview that was transcribed, and then the nominating committee members read all of these applications. And based on the breadth and depth of the leadership competencies, then they decided who would go on the ballot for the general membership to vote upon. So
Mhm.
pretty lengthy process, but every step of the way was exceptionally rewarding. I met new people. I got to engage with them outside of AACN and other activities. We've published together, we've presented at NTI together. My one partner, Pam, she and I wrote a blog on how to volunteer for AACN. So you could look up on AACN's blogs that there's a step-by-step instruction of how to get engaged and how to volunteer, especially some of your nurses. I'd really encourage any nurse who wants or has that vision that they want to become involved and make a difference at the national level. AACN teaches you everything you need to know along the way and how to do things, and you learn from other people from other organizations. And I go to our conference now and I can't walk down the hall more than 15, 20 feet without recognizing somebody or seeing somebody that I know or I've worked with before. So it's just really enriching professionally to be engaged like this.
Yeah, I recall. I think I was right next to you when you got the call that you won the election, and I just remember the joy on your face. Obviously, me and Dr. Menard were there with your husband Andy, and we were just overjoyed for you. So, I just remember the hard work you put in to get on the board, and getting that call really was a culmination of your hard work. And so, congratulations again on that. That's quite an accomplishment. So, I can't imagine that it's, I can't imagine that it doesn't come with some role and responsibility. So what sort of things are you doing as a member of the board of directors?
Yeah, that's a good question, Johnny. The board work is vastly different than what we do from our day-to-day work. We don't go in and round and take care of patients, write orders, turn people. It's very different work, and it's not part of operations. We're not making day-to-day operational decisions. We're really functioning more at the governance level. So when you think about governments, we think about there's three main types of governance. There's strategic thinking. Where does the organization needs to go? How do we navigate changing environments, political environments, evidence changes, things like that. We also look at fiduciary responsibility. Does the organization have sufficient resources? We think about legal risks, and so we analyze some data to figure out what's the best course of action. And then there's also some generative thinking that we do. So we constantly are environmentally scanning. We reach out to people that we know. We ask leaders from different realms that we've ever been in. We bring it back to the table. And we look at what's the current themes that are happening out there, and we generate thoughts of how can we respond? How do we meet these needs? What are common threads across the country? Because we have board members from all over the country, from
Mhm.
as far away as Alaska to, the East Coast here. And so and we've had Hawaii too, so it's even farther. But we look at trends that are happening at the bedside and with leadership, and try to think about how to respond. And then, obviously we do a lot of, it's different. Like you go to a meeting at the hospital and you walk
Mhm.
away with a to-do list of things that you need to go do. This is kind of flipped in that they give us lots of information for us to cogitate on, and we come back and we talk about it at the table and do some sense making of the data. Um, but we walk away with no homework assignment to do, so to speak, which is much different than operational at the hospital of things like that. So
Mhm.
a lot of what I do as a board member, being an ambassador of sharing information of what resources do they have, how can people get involved, cultivating the next generation of leaders, and hence why I'm here having this conversation with you is
Mhm.
there's somebody out there that has the skill mix and has the desire. So I'm hoping that through me sharing my journey that I can excite people and motivate people on how they can get involved and how they can make a difference and follow in footsteps and, reach back, give somebody a hand to give them the boost they need to, take that next leap of faith.
Yeah, that's great. I mean, the nurses that we work with. I've met some of the best people, best nurses you could ask for, best advanced practice providers that have tremendous potential to be a leader in any organization. I think you've offered us a nice guideline on how to work up and become a leader in their organization. So, what practical advice or what tips if you had to, make it very simple for somebody to follow, what tips would you give to that person who's thinking about becoming a leader, just not sure how to take those steps?
Great question. I think it's about changing. I'd say number one, I have three thoughts on this. Number one,
Mm.
change your perspective from someone should to I can or we can as a team. And it's
Mm.
about not everything you have to do individually, but as a collective team, and say, let's do this. We can make a difference. And identify. So along with that goes what skills are needed, who has those skills, find a mentor, somebody who's willing to show you the ropes, um, and gain those skills and ask for support.
Mm.
Number two is say yes. Yes is where the opportunities lie. Even go as far as volunteer yourself. Go out on a limb. Hey, do you need some help with that? hey, that sounds like an interesting project. I don't know anything about it, but I'm willing to learn. So it's in that's part number three, which is step out of your comfort zone. If you don't know how to
Mm,
do it, ask for that help and that guidance. Alex and I had done that. We went to a lecture at NTI on publishing because we're like,
mm,
we got to get our publishing. I mean, we can do this, right? So we went and they said, we have a call out for a special journal, a special edition we're going to do, and this is the theme. And we wrote a proposal, we submitted it. Believe it or not, we got selected based on the topic because we had that vision of we got to do something about workplace violence and mass shootings. Those were the topics that came to our mind. And so we got selected, and I was very upfront with the editor, and I said, I've never published a systematic review. Are you willing to coach us and mentor us? And the answer was, sure, we're going to help. And so we went and she sent us articles. We read the articles. We found more articles. We met with the librarian because we knew we needed some additional resources and help. And we just kind of had it as a team, built people. You came along with some of these projects and, but we were totally out of our comfort zone. So
mm,
you can't be afraid to take a leap. So to summarize the three things is change your perspective as to we can do this, say yes and or volunteer, and number three, step out of your comfort zone. And
mhm.
people are willing to help you be successful when they see that willingness to step out of the comfort zone.
It sounds like mentorship was a big part of this as well. You've mentioned that a couple times, actually. So where did you find your mentors? How did you come across that? For somebody who's looking for that mentorship, what advice would you give them?
Well, there's different types of mentors. There's formal programs that grant that provide a mentor, like for the junior faculty development program.
Mm,
Some hospitals are developing mentor programs, and some form naturally, and some are more. Then there's also like you can hire somebody or pay somebody to be a leadership coach. So there's different levels. I have found most of mine naturally by somebody who has a skill that I want to learn and I just ask them. And it just comes about naturally. I really have a burning desire. Is this something you'd be willing to help me with? Or can I pick your brain? Or what advice do you have for somebody who wants to undertake this? And so, as you gain skills too, that a coin will flip as well as you gain skills, you're going to be able to mentor other people. Think about our relationship, Johnny. We've known each other for, I don't want to give away how long, but I was your faculty, then you're my
mhm,
peer, and then I was your doctoral faculty. And I've always reached back and given you that hand. Hey, we need some help on this article. But you've also ponied up and said, hey, I want in on this game. I want to know how to do this. I have this burning
mhm.
desire to learn. And so it's become a wonderful collaborative relationship that we've developed through the years. But it's that reaching back and mentoring other people as well. So,
Yeah, I agree. You've been a tremendous mentor to me. I have other mentors throughout my career. It's just sort of happened naturally for me. And they've coached me. You've coached me, showed me how to do things through your experience, um, I find that mentors don't always agree sometimes, and they give you a different perspective and a different way of looking at things, and um, that is been the most beneficial part, I think, oftentimes is the constructive criticism, feedback, and guidance, and that's how mentors have been for me, and it's encouraged me to pay it forward and to try to mentor other people in my everyday interactions. Dawn, thanks for really taking the time to talk about leadership as through the nursing world, through advanced practice. Um, you've given us a nice guide on to how to work through your career and develop your leadership skills and become a leader throughout your career. Do you have any parting thoughts? Do you have any, if you had to conclude this podcast, do you have any parting thoughts? Anything that you'd want to highlight or reiterate for us?
Yeah, I think since I have the opportunity to say one more thing, it is take that chance.
Mm,
Go out of your comfort zone, take that chance, and ask for guidance. And people are going to give you guidance. Sometimes they're going to give you some tough love. But you have to be able to embrace that feedback, as you've pointed out. But really
mm,
take that chance, because that chance is just so worth it, and you're going to learn so much through the process. So
mm,
I would just say take that chance. And as I'm, looking forward in my next, 10 years of retiring, this is my prime opportunity to be that mentor for other people. So I'm more than happy to have anybody reach out to me. My
mhm,
email is dawn.carpenter@aacn.org. They can
mhm.
reach out if they have any questions about AACN initiatives. They can reach out for leadership guidance, or mentoring. I'm happy to engage with people in any way, shape, or form that I can help advance the mission of AACN, as well as to advance people's journey in leadership.
Yeah, that's great. I know there's a lot of nurses who may just have some questions about what organization they should join, and if they're in AACN, what committees they can do, and what volunteer work they can do, and how they can become on the board of directors, or how they can publish. And it sounds like AACN has a lot of opportunities for nurses and advanced practice nurses. And so, Dawn, thanks again for sharing your leadership journey with us. This is going to be very useful information for people who watch this as they embark and continue in their career. So, again, thank you so much.
My pleasure, Johnny. Thanks for having me.
Thank you for joining us on another episode of the Crit Chat podcast.
It's critical chats, Shayla.
Remember, you can watch the podcast video on YouTube or listen to us on Spotify, Apple Music, Castbox, or Amazon Music.
Everywhere.
Yeah.